guys, I had a situation come up where my therapist and I were talking about how and when to treat an acute injury, acute muscle injury with needling and whether we should or not. So we were talking about this and I was like, you know what, we should really share this with the group. Some things to consider. If you have, let's use a hamstring strain as an example because that's something that frequently happens. And a lot of times athletes that have a hamstring strain, they want to get on the field fast, right? They're trying to get back. Can we facilitate that? Can we help this? There obviously is the initial thought of if a muscle is swollen and guarded, that it's there for a reason and that we want to help facilitate healing in that area. And maybe we shouldn't be messing around in that area and inducing more inflammation. However, what I want you guys to consider is that there are other things that we can do to facilitate recovery in that area. So if you consider this strain area as like a scab, and we think about if it were a scab, what we want to do is open up other things around it so that scab isn't getting tugged on all the time. So one of the things you can treat an acute strain is by treating the surrounding attaching muscles, the areas that are in close proximity to that injury site, but maybe not the injury site directly. So for instance, if it was a high hamstring strain and it's not visibly overly like bruised and super swollen, then you could essentially needle the other components of the hamstrings to take pressure and reduce the incidence of pulling on that strained area. So that's one consideration. Another consideration is that you can needle the back, the multifidi, in the segment that correlates to the muscle that was strained. So take the hamstring example again. If you needle the multifidi, and I would add stim to these for sure, needle and use electrical stim to the L5 multifidi, you're going to get blood flow increase down to that hamstring attachment site. So we can facilitate healing by working around the areas and not necessarily sticking that needle right in that injured area. So hopefully that helps you guys if you're problem solving with your athletes and you want to get them on the field faster. Give those a shot. DM me or email me if you have any questions, and I hope it helps.